Hello everyone, I'm Paridi and I'm the representative from the team Healthy Minds World. A very good morning to one and all. Before I start, I just want to check if I'm audible. Okay, I'm guessing I'm audible. Just a second. Uh, right, I see a lot of you have already joined. Let's begin. Uh, First of all, thank you so much for joining this session today. It's definitely something that I would like to, convey from the team that we appreciate on a Sunday morning, attending a session, especially when it comes to mental health, taking that time out, prioritizing yourself is extremely important and we appreciate that. So to start with, I'm going to talk a little about, I'm going to introduce the team and how we came about. And especially, before that, I would want to um, just talk about how now that we're, 5 months into the lockdown and irrespective of what part of the country you are in, I just want to emphasize that we're still dealing with the virus. The threat is still prevalent, so just hoping that you guys are ensuring precautions, you're following the guidelines and not stepping out until and unless it's extremely urgent. And even if you are, then you're following all the precautions and guidelines, using a mask, sanitizer, etc. Right? And yes, so then talking about our session today, which is on the impact of fertility and pregnancy complications on the mental health of women. So to start with, let's just talk a little about uh, a little about the background about Healthy Minds World, how we came about. Right. So Pallav and Vivek are the ones who had started the platform almost 4 to 5 months back. Yes, it does coincide with the time when the lockdown came into effect, and they had already been working together on a different business model. And like many others, their setup was also something which had been impacted by the pandemic, by the lockdown, and their conversations in terms of understanding the extent of this impact also brought about this realization that when it comes to an important aspect, not just professionally but also personally, right, and especially that of our mental health, it was something which had high chances of being neglected and in some cases being aggravated due to the environment, right, due to the conditions. And yes, so with that, they decide with that realization, with that understanding, Healthy Minds came into being. And today, under the great guidance of Khushbu, we have expanded and we're now a team of almost 15 young individuals, ranging from senior psychologists, counselors, therapists, as well as marketing and mental health professionals. And really, at this point, I would want to say this, convey this from the entire team, that it's great to have you guys here, especially emphasizing the fact that it's a Sunday morning. But overall, in our journey so far, it has been incredible, the feedbacks that we receive from you. Now that we're on our 11th session today, it's important that I point out the kind of messages we get, the kind of feedbacks, inputs that you guys share definitely help us in our learning, in our journey. And we definitely value them and try to improve ourselves with each session, with each step. So please keep that coming. And we will also, when it comes to this session, right, for those of you who are joining us today for the first time, I'm going to give a little context about why we're doing the session. And for those of you who have already been a part of our journey so far, again, thank you so much. we really value your presence, your time. So, making women's mental health a priority was a series we launched some time back, right? And the intention was to understand that when it comes to a woman's life, there are various roles that she has to play, and with each role, there comes a totally different set of totally different set of challenges that she has to face, right? And how those challenges impact her mental health is something which definitely varies. The way it impacts me totally varies from the way it would impact you or to third person, right? But our objective was to understand that what is the best way to face these challenges and how to overcome these challenges from a psychological perspective. So we had covered a series of aspects ranging from physical, psychological to financial challenges that women face. And if you would like to have a look at the sessions we've covered, we're on our 11th session, and we're nearing the end of the series, because we feel that we've covered several aspects that overall help women in the journey of life. And yes, as I was mentioning, that if you would want to go back to the see the sessions and view them, then we will be sharing the links to them sorry, on the chat section. So then please do check out. And yes, so as coming back, it's definitely nice that as a team we're here, and we've been able to conduct sessions and workshops around various aspects when it comes to psychology, not just from an academic perspective, but also from an awareness and engaging perspective, for someone who is not particularly from the field but also wants to understand mental health from a broader perspective, in terms of what are the different disorders, how can one perceive them, not just from a victim, not just from for someone who's going through it, but also if you want to help someone deal with something that they're going through. So yes, without wasting any more time, let's move to the topic for today. And on that note, I would want to introduce our guest for today. We have Miss Ajab with us, who is a trained clinical psychologist with over 14 years of experience, predominantly in working with hospitals and schools. She's also been working extensively to remove the stigma around mental health, and in the process, she's working on creating a healthy environment for people to seek help without fear or shame, right? And apart from that, uh, hi, Miss Ajab. Good morning.
Good morning, Paridhi. Thank you so much for introducing me.
Thank you. So, I hope you're doing well.
Yes, thank you so much. It was
So,
good listening to you.
perfect, perfect. So, thank you so much for joining our session today, right? We're going to be talking about the impact of fertility and pregnancy complications when it comes to women's mental health. So, before we begin, I have a little introduction that I would want to set for the participants about
Yeah,
the
please.
topic.
Yeah, please.
Right? So, when it comes to fertility challenges and other pregnancy related complications, there is it is believed that women face a silent struggle, right? They don't open up about it, and they don't really confide in anyone when it comes to their feelings, especially related to depression and anxiety, and they resort to isolation and sometimes even complete cut off from people around them. And though there is an increase, I would say actually, in fact, that since there is a increase in the fertility issues faced by women, there is also a large number of women who do not share their stories, their struggles with people around them, with their family, friends, which in turn increases their psychological vulnerability. And they also tend to avoid then socializing. They tend to not go out as much, and They also then refrain from participating in support groups, which definitely is problematic, right? So our session today is an attempt to understand what are the best practices that women can undertake, and yes, from both a psychological perspective, and also understand how support groups, how support systems can play a role in terms of dealing with it in the best manner.
All right. Thank you.
Perfect. So we have some questions for you, Ms. Ajab, that we would want to get your insights on.
Yeah,
And as for
sure.
the participants, we have our panel with us who can help navigate through these queries, and then I can put forth them to you. Does it work?
Yeah, sure. Perfect. That sounds great.
Okay, great. So guys, with that, I think we're all set to then begin the series. Uh, right. Okay, I think I did. Yeah, I think no, more or less we've covered aspects. So before I begin with the questions, do you think I've covered the topic for today?
Okay. Parati, if you permit, can I just add to what you just said before we start with our question answers to give a brief background about what exactly this particular situation is like? How, because see, when we talk about any psychological perspective sends on the tripod of biology, cognition, that is my own understanding, and the society in which we stay. So a lot of it is dependent for any factor which we look at as the combination of this tripod. There are people, those who are suffering from infertility, but they are quite open about this perspective and they are okay with it. So their cognitions is fine with this particular perspective and they do not face it in a harsher manner. On the other hand, we have a support system which you just talked about. It is the social structure. Depending on the society and the culture which we belong, and how that society frames this infertility or the ovulation issues or childbearing as an issue, if that is something which is looked forward, that depends a lot on how the person or the couple going through this. Because see, when we are talking about females mental health, your a female's mental health is also dependent in this particular scenario. It is also dependent on the partner and the family, both the families. So
Right.
how they are connecting it, it is surely connected with the cultural perspective as well. So anything which we will be talking about will be a combination of all these three, irrespective. It can be a cognitive perspective, it can be a biological perspective, or a socio-cultural perspective. So we will look into our questions in that manner, where we'll be addressing all these three perspectives in a combination. Will it be okay? Am I clear about it?
Yes, yes,
Yeah.
definitely. I think
All right. Yeah, Paridhi. Thank you.
perfect. So I think we have set a great context for our topic,
Yep.
and then starting off, can you help us understand that given that women face various kinds of fertility issues and complications, right? What are the psychological implications of these?
Okay, so let us talk about what fertility issues does women face first. So once, because as I said that there are biological constraints along with the cognitive and physical constraint and the social. So let us look at the fertility issues which are more biological. So it can be starting with the failure of ovulation, that the female is unable to ovulate and that's the reason the female is unable to conceive. It can be problems in their menstrual cycle, that they are irregular menstrual cycle, and that can also lead to a problem where they are unable to conceive. Structural problems in the reproductive system, that the structure of that reproductive system is not in a normal phase. Either they have an inverted uterus or a bilangular uterus, leading to a problem in conception. Failure of an egg to mature properly, like irrespective, the ovulation takes place but the egg is not getting matured enough in time. Implication of failure, like implantation failure. So the sperm, maybe the sperm is not that strong enough to ovulate with the egg, and the implant, the process happens, but the implant doesn't take place at that time. Endothormosis, which is again an internal process where the 28-day cycle is changed in a different bilateral process. And these are with different perspectives. Now, when we are talking about these biological perspectives can be treated only when they are treated with medicines. But with this biological perspective, till the time the female gets a perfect scenario of what is happening in the body and the correct version of it, there are so many psychological implications which happen during that time. The social pressure, oh, शादी को इतने साल हो गए और बच्चा नहीं हुआ. Like, I'll be using bilingual at some time to make it more clear. I hope it is clear with all the participants as well. So here it is that social pressure. Again, depending on that society which you come from, it becomes a problem. Otherwise, and many people who want to go for planned baby, they have tried it for a couple of years, and then the distress that, oh, we are trying since long and still we are not able to conceive. So that distress and the longitudinal period of time, oh, we have been trying since so many years and still we are not able to. So with this perspective, it happens that there are lots and lots of perspectives in which the infertility is not only a problem as infertility. It is a combination of multiple other things pushing up and giving infertility as the basic criteria. So infertility to wo bichara side mein kahin reh jata hai, but the stress and anxiety, and this leads to many psychological disorders like anxiety, depression, the perspective of selflessness, that I'm not capable, I'm not a perfect woman, or I'm not a person who is capable of childbearing, so I'm inadequate. These all feelings start popping up in the female's mind, and these feelings really pop that person to a negative self-respect, where they do not even see themselves as a capable person. Not only with childbearing, it affects their day-to-day routine. They are really pulling themselves down in their workplace, in their homeroom environment, in their relationship, in their rapport with their spouse and the families. So one particular implication of not being able to bear child leads to a whole segment where it becomes a bunch. So we start, if trying and explaining it in a positive manner, we start just from a flower which becomes a bouquet of problems. Sorry, I just quoted it in a positive manner, but it was a bunch of problems. So this happens where we are talking about the fertility issues or maybe the infertility issues, which can be solved easily if targeted and found out at a very initial stage. But what happens is that usually people do not consult a doctor. As the Indian social system, when we talk about, they are mostly dependent on the problems of people around them, or the elderly, those who have multiple kids, getting guidance from them. Acha, nahi ho raha hai, try this. Why don't you try this? Why don't you try? So multiple trial and errors, which makes the time prolonged. And this prolonged time leads a lot of stress and adds to the stress. And by the time they actually feel that they need to go and get medical help, till the time they have exhausted themselves mentally. Here I'm not talking about the physical criteria. Mentally and psychologically, they have exhausted themselves with a negation that nahi ho raha hai. Am I like, I hope I'm answering your question. And that the other aspect which comes over is the financial thrift. That, oh, बच्चा पैदा करने के लिए हमें इतने सारा पैसा लगाना पड़ेगा. If they come from a wealthy family, the IVF treatment or other kinds of treatment are still fine. They can manage with it, because again, a person who is trying hard for a kid, they would try and save, spend all their investments into it. But then there is not a sure shot guarantee that this particular concept will happen, that this particular thing will be a progressive run through. But at that time, they are trying and putting all their investments into it. And if they get results, wow, great. If they don't, then it becomes an added negativity in their mental health. That, oh, we tried, we spent so much, but still we are not able to get through what we exactly wanted. So failure sets in. And this failure leads to, and because of that stress of failure, the IVF treatment, it is said that, okay, there are lots of counselings happening also with them. But with the stress of failure, there are more chances that they are prone to not getting the conception happen because of the stress already imbibed into it. Hoga nahi hoga, hoga nahi hoga, hoga nahi hoga. So this leads to a lot of stressful situation. So this is where fertilization issue, along with going for treatment or therapy or the kind of treatment, medical treatment, combines and gives them negative feedbacks.
Okay.
Yeah.
Definitely. I think we've had you've provided the response in a wholesome manner,
Yes.
not
Thank
just
you.
looking at it from a biological perspective, but also understanding other areas that are extremely critical when looking at fertility issues. Uh, Also, do you think, uh, you know, there's another side to this question? Do you think it is, a trauma, and often a complex trauma for some women when facing these issues?
Yes, it is a complex trauma. I'll not say for some women, for every woman. Having a childbearing issue is a complex trauma for every woman who is going through it. Now, this complex trauma can be handled in multiple manners. So, if the woman herself is strong enough that it's okay, I am not fit, or I'm going through therapy and I'm getting to get out of the situation with my own help and with the help of the experts into it, that is the main cognition which we start with. If the woman has it and they can overcome it, and without anybody even noticing it, they fight it and they combat it and they move ahead with it. In case if there is a woman who has a strong support system of the family, of the spouse, where they say that it's okay, we are there to be with you, and we will be there throughout with you for your perspectives, in that the mellow of that situation happens. In that situation, it happens that the woman is broken but still is mended. Like, I'll take the example of a Japanese system. Wherever the bowl is broken, they fill it up with gold fillings to make it more precious. So in this particular system also, they say that if the family is supportive, it is said that the women is broken, but the support system given by the family acts like the golden dust which is there to fill up that jar, so it becomes more valuable, and the child is more precious to them rather than a taboo. It is considered that, oh, with so much efforts we got a child and my family was there when I was in this childbearing process. So it becomes more as a precious child and the precious process of motherhood. The other perspective, that women, those who are not willing to share or are scared or ashamed of this phenomena, that, oh, I'm not able to bear a child. And that is, and why again this? Because as a female, the first perspective of a female is to go to the next, or to bring the next generation into this world. So this is the main cause of you being a woman, as it is portrayed in some of the families and how they have been upbrought. So that upbringing, when this particular process changes in them, it is like, oh my God, I was there for only this purpose and my purpose is gone. So that gives a different socio-cultural impact. Whereas some people there, when the support system is stronger, oh, we are trying with these aspects, but in case if it doesn't turn up with us, we are fair enough. It's okay. We'll adopt a child. Don't worry. Your motherhood is not going to just be that the child has to come from your own womb. So, this is how different perspectives happen. But when we talk about these perspectives as the factors, it is about the mindset, how you are mentally set for it, and how you are going to take this particular process. And as I just said in a few minutes back, that initially, if I have taken it as a stressful situation on me, I'm going to take the whole process as it is, not as something which is a boon, or it is a human deficit. Like a person can have a uterus deficit, which is as common as having a heart problem or a lung problem or a liver problem, but it is not observed that way. It is observed as a completely different and a completely uh, tabooing scenario, and that's where the women start deteriorating. Now, when we talk about children, women mental health is completely at risk. Why? Because women are usually seen as the whole and soul person responsible for the process of not being able to bear a child, whereas it is not only the women who is responsible. It is a two-way process, because both the spouse partners are involved in that. And maybe the women is inadequate, but most of the time it can be that the males are also inadequate, but that stress is also levied onto the women. And poor women, biologically she's sound, and she's mentally given that negative perspective, and she's unable, because of that stress she's unable to conceive, because she's in a stressful situation. Imagine we all are stressed. Will we be able to enjoy the dinner which we are having? No. So if a simple thing of having food, if we cannot enjoy, imagine the process of motherhood, which can be so smooth and so loving. With the stress given to us, it can be deteriorated. And this happens not only in low profile families, it happens with, irrespective of any economic background, it happens to every perspective. Every strata of the society is in the same boat. It is no different.
That's the bitter truth, I think.
Yeah, but we have to face it.
True, true, true. I think just to recap some of the key points that you mentioned here, that it is a complex trauma for not some women, but for all women, because the level of anxiety, the level of stress faced in combination with a lot other factors, including social, cultural challenges that they face. And I think another key part that I would want to highlight at this point is, about how in scenarios where it is not the woman who is
Responsible.
facing, yes, if it is if it is the husband who is facing problems, and there is the added stress for women there as well, which is definitely something which isn't talked about. So I think for those of you who are here, and I think the main way to decrease the trauma faced by women is gradual steps, but also acknowledging these aspects as well. As a society, especially, these I think can be great. Moving on, you were talking about counseling sessions, right? When we while talking about IVF treatments, there are some institutions that do offer counseling sessions as well. So then how helpful do you think are, say, short term counseling sessions, and what is the best time to start these?
Thank you for putting this question up, Paradhi. This will like really help me give a bright light to the perspective of counselings, and not only for people at the initial stage, and how and when it has to be started. Thank you. So when we talk about counseling, counseling is usually looked down upon. It is said that, oh, unless you face a problem, you don't need counselings, or you're not mad because you're going for counseling. Usually, whenever we talk about counseling as a perspective, it is taken in a way where people are given knowledge about what exactly they might be going through. So when we talk about counseling correlated with infertility, or how people are going ahead with this perspective, first is the basic counseling, that what can be the possible issues for you, either falling into the criteria of infertility or into the concept of conceiving and moving ahead. So that is the basic knowledge sharing sessions, which when you go to a doctor, a gynac, who would suggest you to go to a specialist, and they would, the IVF specialist. And now IVF has become a very common platform. In this, it is not necessary that if you go for an IVF counseling, you have to go for an IVF. No, they give you a background about what can be done, how they are sharing their views, what is the precaution, how can you do trial and error at multiple points. This is the basic line of counseling. Then comes the next step. After this counseling, you have tried whatever they have said in the medical perspective, gone ahead, tried it in the perspective of different stratas. And in that, how you can go ahead in the next step, that you tried with all the basic things as counseling given. but then still it did not work out. So now what is the next process? So they tell you about the medical facilities available for bearing a child, either in, you can the concept of surrogate mother, the concept of IVF, different perspectives in that manner. How you can talk about that happens as the second step, and this I'll say as the specific counseling correlated with childbearing. With this, the third perspective comes. This is where we have to be a lot more focused on the understanding of you being mentally healthy and sane to connect with the perspective of childbearing at a next stage. So here, when we talk about counseling, it happens in three ways. First is just the knowledge sharing. Second is how you can go with the medical facilities and treatment. And the third comes at the third level is how you can be mentally healthy to go through this whole process and go ahead with a sane mind and a decent mindset rather than taking it as a stress and pressure. So can I share one research over here to make it more precise? So, Harvard Medical School, we all know about that. We all must be like, as we are talking, Harvard is an amazing medical school and all that. So, they did a research, and okay, these research is a longitudinal research where they started coming up with people, those who needed artificial insemination and infertility process was at a very larger stake. They counseled, so they took up 24 subjects, and in that, they divided into three groups: group A, B, and C. So in group A, they just provided the medical facilities which were required without any additional support system, so without giving any counselings or anything to them. In group B, the medical support system was given, and the all the counseling and different kind of therapies, not only counseling but pure sure shot psychotherapies and cognitive behavior therapies were given to them to make them sane and decent and to go through the process of childbearing. And group C was not given the medical facilitation, but only counselings and therapies to overcome with the perspective of the trauma of childbearing. It was found out that group A, the same medical process was given to group A and B, still 90% of people were unable to conceive at that time because they were mentally not stable to accept the procedure in their biological system. They knew that they were going through it, but 90% of the people did not conceive in that tenure. In group B, all 100% people conceived and they delivered healthy babies. Both the couples, and again, in this counseling process, women were given more priority than the spouse because they were the ones, those who needed biological support. The third system, it happened that 40% of the people, those who were given therapies and positivity about childbearing, they developed their pregnancy according to the natural process, and they did not require the additional medical facilities which were suggested to them earlier. So, how our own cognitions can make us positive and move ahead towards our progression. So, through this research, it was proved that if we can change our thought process, if we can change our surroundings, if through therapies, if we can change our positive perspectives and go towards our goal in a good manner, it can happen. See, we cannot combat the biological incapabilities, but still, with the positive aspects, we can work it out in the best manner and move ahead in the progressive manner. So, I wanted to share this because I wanted people to know that everything is not in thin air. There are researches to support what I'm trying to copulate and go ahead with it. So, these are proven facts that with psychotherapy, cognitive behavior therapy, just simple counseling where the couple feels that they are being heard also helps a lot and supports a lot.
Definitely. I think thank you for sharing the research. I think it definitely, helps to communicate the message more effectively.
Yeah.
Uh, so my next question then to you is, furthering the aspect about therapies, right? How important do you think are psychotherapies, especially interpersonal therapy and CBT, cognitive behavioral therapy, when it comes to women who face fertility issues and other pregnancy related challenges such as miscarriage, or when they're trying to conceive after the birth of their first child?
All right. Thank you, Paridhi. For this question, I'll just go that when we talk about these three perspectives which we are discussing, infertility, or after the birth of the first child, the conception of the second child, the trauma happening at that time, and the time when you know that you're not able to conceive, there are these, we'll term it as simple way in pregnancy complications. So we will just term it as simple pregnancy complications, where drug therapies and hormone therapies are induced. So when you are using drugs and hormone therapies, as it is, there is a lot of biological changes happening, uh, and it is a lot of stress to them, because the drugs, they firstly they are under a stress that they are not able to conceive, or they are losing their baby, or the womb is not strong enough to hold the baby for a longer time. Now when we talk about these situations, drugs are basically who are given to make your womb stronger. And when I say make your womb stronger, you are playing against the nature's biology. So, of course, it is going to give you a lot of stress, additional stress with the induced hormones and the kind of stress you have. So, first is the intrapersonal therapy, which will be the best effective in this situation. And the drugs, when we say drugs which are given, it does have their own side effects also. Because if you are on hormone medications, it is releasing maybe excessive hyperoxytocin, maybe. And that oxytocin level secretion is putting you, oxytocin is responsible for you to feel the way, the grief or the happiness around. So oxytocin can lead to two stratas, either to the extreme of you being really very happy, 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 or really being very sad, sad, sad. But in this situation, the mental setup is towards the negative, the sad side more. So it leads to depressive episode at a larger extent. So, with these drugs, when oxytocin is released in your body, you need to help yourself in controlling the oxytocin secretion and managing that. In, you cannot control the internal hormonal secretion happening with the kind of drugs given to you. You cannot control that, but you can control how the drug is affecting you, how you allow the drug to overpower you, and that happens strongly with intrapersonal counseling or therapy sessions, where you make yourself strong enough to face the situation and go ahead and combat it well. Second comes as the concept, and which is the most prevalent psychotherapy situation and the ongoing therapy pattern, and which I also practice very strongly. It is CBT, that is cognitive behavior therapy. Because we work with people, initially it was said that psychology is the study of human mind, but practically it changed out. No, we cannot go into anybody's skull inside and look at the brain and see what's going on. So it changed into a perspective of human behavior. But how do I change or alter my behavior? By changing my cognition, by changing my thought process. So with CBT, the people, those who are going for IVF treatment, they are given positive aspects of their scenarios, where they are given that way that their cognitions change toward the positive paradigm. And with CBT, positive psychotherapy comes as a combination. Now, when we talk about going for therapy for these women, those who are going to mental health traumas and mental health disasters, I'll not say that only one specific therapy pattern works well. We work with an eclectic approach with them. And when I say eclectic approach, it is a combination of different therapy patterns. May it be intrapersonal therapy, may it be CBT, positive psychotherapy, or group interventions, where there are women who have similar issues and they share their own experiences and their own suggestions and their path through, which makes others motivated to go through that. So these can happen as combination depending on how the couple formulates and moves ahead with it. So therapy, again, I'll not say that one therapy is sure shot perfect for everybody going through this. No, it is either a combination, or, and when we talk about women's mental health, mostly as a part of women's mental health, we need the support system also to be equipped. I remember you just saying that how we can train the society, or how we can enhance the society to make the women stronger. So if we can have counseling or therapy sessions, not only for the females, but a combination of family therapy, where the whole family is involved and made understand that it is not a guilt trip which you're taking that poor female to. Come on, stop making her feel so bad about herself. If we, and this happens, and this is the most effective one, because the female starts feeling positive about herself, whereas the support system also makes and promotes that particular situation. So here we can have a combination of therapies with this situation, and most of the gynacs do support it. Most of the IVF hospitals have this kind of support system where they have therapists and psychologists supporting this particular scenario, and they're equipped with biological perspective, socio cognitive perspective, and the society and the cultural perspective. And with every female, it is a different kind of a therapy which is required, because a simple thing, one size does not fit all, one therapy does not fit every woman around. So in that manner, we have to alter and create a specific, which we call as individual plan for every female who comes in for therapy, and comes in not only for therapy for this particular mental health situation, but for a therapy where the child women is feeling that I'm unable for the childbearing process.
True, true.
And not only, okay, when I talk about childbearing process, sorry, I just recollected one thing which you had asked in your question. Childbearing process is not only always for the first time that you're not able to bear the child for the first. It can be a combination that after the first child, the woman is not able to conceive. Maybe the woman has bloated up, maybe the complications and the hormones have started up after the first child, and the second childbearing process is equally stressful. There is no concept that, oh, you have one child, so your second child will not be a problem. So equally stressful in that particular position also, in the second child rearing process as well. All right, Bharati, thank you.
Thank you, Ms. Ajab. That is, I think, a great perspective. Uh, Also, where you mentioned about how rather than just the counseling being restricted for women, it can also become a family therapy process to help to support the woman from in what she's going through. Also understanding one of the aspects that we were earlier discussing, that especially in cases where women have to take the blame of say
Absolutely right.
infertility issues or problems in conceiving. Especially I have a question also from one of the participants with respect to this, about how challenging it is for women to take the blame of either reproductive or sexual failures, and sometimes even to the extent of uh, a homosexual partner.
Yes. So I'll just add, when we talk about here, we are talking about three perspectives. One is the reproductive failure. Second is that you are not sexually active, and that's the reason you're not able to bear, or maybe you're not enjoying the sexual procedure at that point, and that's the reason you are unable to conceive, and being homosexual. When we talk about this is the blame game, which is usually put up at the female by the spouse, either for a runaway mechanism, that, oh, I don't want that blame to come to me, so rather just blame on my other partner, and female is a scapegoat. So it happens with them. When you talk about homosexuality, it has become a very common scenario in today's world. Say in the last decade, it has become very prominent, where women are also tabooed with this particular scenario, that, oh, you are not able to bear a child, are you interested in women, not in men? So, in a jovial manner, they just put it in a sarcastic way as a blame game to that female. And maybe it can be correct in some of the cases, and they don't even bother about it. But still, when it is put up to people, those who are not involved in that process, and then it becomes a problem. And they are not sexually active because maybe the way in which, and I said now that only in the process where you are just thinking about having a child, bearing a child. So that sexual urge is also not for enjoying that process. That sexual urge or that particular process is just for the process of bearing the child. And that stress, when the women or the male at that point are carrying on in their mind, and there are less chances of their ovulating or the sperm count being stronger, and it becomes as a very very stressful situation for them.
True. I think there are also some, movies that also talk about this. Now that you mention,
Yeah, I was just thinking about Good News, which has recently turned up. But though it is given in a very funny manner, the reality is portrayed really very well. How that particular situation is equally stressful. They have given combination of two families, two successful people, how difficult for them also it is to face society and see that, oh, you are successful in life, doesn't matter, but you don't have children. And this is something which, and that's why I brought up that socio-cultural perspective. This is, we are talking about the Indian cultural system. Irrespective of whichever levels you reach, you have to have children. Why? Because, oh, बच्चे तो होने ही चाहिए, तुम्हारा generation आगे कैसे बढ़ेगा, in that perspective. And on the other hand, they had shown a family whose only purpose of life was childbearing, because they came from a very wealthy family background and they were married. It was a very nice happy couple, but a happy couple is complete only if they have children. Husband and wife cannot be happy, and both in both the situation it was the stress on the female partners only. So Karina and I forgot the name of the other female,
Kiara.
Kiara Advani, yeah, thank you. Both of them were at the pressure, irrespective of their age, irrespective of their socio-cultural perspective where they were standing, irrespective of the academic perspective, which I remember Karina was shown to be a very progressive journalist in that movie, but still being so progressive, so outspoken, so open about the world, but still her world was constrained about bearing a child.
True.
So this is how society puts a lot of pressure onto us.
That's true. That's true. Okay, so
Yeah.
moving on, I have a question from a participant. Uh, the question is, how will the mental health of a woman be impacted if she is on strict bed rest for the first 8 months of pregnancy because of cervix issues?
Yes. Thank you for bringing this question, because childbearing is not only the concern. After childbearing process, the things which are involved and associated with the child coming in life, and up to an extent after the childbirth, when you have to have those 40 days when you are staying alone with the child and you have biological changes happening in your body, leading to postpartum depression, which is a very very severe disorder, and it needs medical attention at that time. But when we are talking about a female who has been bedridden, the first stress is that you are not allowed to even follow your ADLs, doing your own daily activities. That is only stressful, which makes you feel incapable. The second mental health issue comes up is that you start developing a negative feeling towards the child, that because of you I'm going through all these negative traumas in my life. Because of you I'm so behind that I have to be dependent on others for my basic routines. And again, your support system plays a very very strict and vital role. And when I say support system, it is in that bedridden state, how the family and the people around are supporting that person to go ahead and take it as a positive perspective. Oh, wow, lovely. You are getting a chance to take care of yourself when you are bearing a child and giving new life. That enthusiasm, if it is levied in that female, the mental health of that female will be sane and sound, and she will be the most happiest and the most flourished female on the earth, given all the importance. But oh, what kind of a person you are, and you were not able to bear a child, and now you are with a child but you are in that distress form, pity you. This is negative inclination. And with this positive inclination, if the female is given this positive inclination on a regular base, like we can say it can be a medication dose to them. three times a day if someone just appreciates you. And it is not only for this pregnant women, for the women those who are striving hard to conceive or have a childbearing thing, if positive motivations are given to them on a regular pace. Just going back to that Harvard University case study, research which I just explained, 40% of the female who were not even given medical treatment were able to conceive. Why? Because of positive psychotherapy which they were given. So it is in that 9 months or 8 months before they are uh, able to give birth to that child, if it is a happy situation, if it is made happy, or if the female herself introspects and that intrapersonal therapy is given to that female, that you are doing this for yourself so that you can enjoy the concept of motherhood in your life. If this mindset is developed in that female, this 8 months will be a gala time. And imagine nobody will allow you rest for 8 months rather than this situation. I don't believe any one of us would be in bed until unless we have a mindset that we are going to have a baby post 8 months. And that happiness will combine, but it has to be happiness. You cannot just strive it to be a negative perspective. And that happiness can and usually I'll suggest that introspection or intra relationship with ourselves is the best way of combination of leading to a happy life.
Oh, that's a great, aspect, I believe,
Yes.
and I hope we have the response to the respective
Yes.
participant there. So I'm gonna quickly move on to my next question. Then, right? We were talking about medications and hormones, right? That are
Yep.
used to treat fertility, which may cause a variety of psychological side effects, and patients and clinicians may find it hard to identify that which reaction is caused due to psychological uh, aspects or which are caused due to the medication.
Okay. So as we just started with our previous question, previous to previous question, in that we were talking about medications, and medications do lead to hormonal imbalances at that time. So that can be a reason. But then when we talk about the psychological implications or the effect of medications, there is a very fine line of difference between them. So at point it is difficult that it is a combination only because of the medication, or it is a combination of medications along with psychological things. So in this kind of situations, usually both situations are clubbed together and trial and error is given. जो चल गया उससे हम ठीक हो जाएंगे, in that perspective. So when you're talking about this trial and error perspective, medications are necessary by any situation. Like whatever happens, we need to give medications. Though we know that it has a side effect, medications are required and you cannot deny it. So medications are given to them. And when we are talking about medication, before we start with that negative perspective of the psychological implications starting in, they are started with therapy beforehand. So prevention is better than cure. That situation is happening to these perspectives.
Right.
So rather when they start with medications, they are also starting parallelly for therapies, and this is how it goes ahead very smoothly. They don't wait for the symptoms to have onset. This is the general practice which is happening with most of the females, those who have approached professionals for these criteria. They don't wait for problems to start. Before the problems start, they start having those particular therapy started for the people around them.
Right. Okay, I think I have another question from one of the participants, which is about which is slightly complicated and looking at a socially cultural perspective, something which I think also needs conversations around it, which is that when women bear female children, they are still treated as infertile or barren with respect to the whole I would say the, socially cultural stereotypes when it comes to, beti hui hai beta nahi hua hai types hai. So there are several instances, where she has to either resort to, or view female infanticide, and even losing her husband to family accepted adultery, or even her husband's remarriage, since she is, then shown as barren to the society. What are your takes?
Yeah. So with this question, I'll just concise the question that beta to hona hi chahiye. This is the mentality. But the main constraint is beta hoga ya beti hogi. Biologically, the father is responsible for that and not the mother. This is the basic rule, which, if we can have this awareness spread, it leads to a lot of dilution. But then again, beta hai jo meri आगे चलाएगा मेरी जनरेशन को और मेरा वंश आगे बढ़ाएगा. बट बेटा होगा या बेटी होगी, इट इज रिस्पॉन्सिबिलिटी ऑफ योर सन एंड नॉट ऑफ योर बहू. This is the first thing. When you talk about females, those who are pressurized to have male children, it is something which they can only have counselings for, because see, they are not infertile. They are termed as infertile because they are not able to bear boys. This is their combination of infertility given to them. And when we talk about this infertility criteria to them, it is pure family therapy which is required at that point. And nothing else can be worked out, because see, bearing a boy or a girl is not in the hands of the female. It is the XY or XX chromosome, which is the responsibility of the male. When we talk about this biological perspective and female therapy, or family therapy is given, female may have a chance where her respect is gained back. But that pressure, if it is coming, here I'll suggest that the female has to be given therapy, cognitive behavior therapy, in such a way that she becomes strong enough to understand and fight for her own self. There are lots of NGOs, there are lots of awareness campaigns which are run by the government, run by special institutions. I'm also associated with one NGO which is working for this awareness of female infanticide and how not to kill women. But I have also seen a change in the society. I'll say a 180-degree change, whereas women are somehow now respected more as compared, like beti hai to beti is considered to be a more wealthier asset to the family rather than the beta. In certain cultures, girls are like in Muslim cultures, female, like a girl child is considered more important than the boy child, because in their history it is found out that the hierarchy ran from the daughter's side of the family and not from the son's side of the family. So this is a completely different situation. In that, there is a lot of awareness which is spread in rural areas. Now, this concept, when you talk about, it is again not correlated with rural or urban criteria, but still mostly seen at a larger extent in rural areas. Urban areas are also not that bifurcated, but still mostly it is seen in rural areas. So then there are lots of perspectives in which we are talking about government working at a very large extent and putting in a lot of efforts. So illegality of female infanticide, so you cannot get the sex changed of the child, checked of the child before birth or before the delivery. These all legalities, like it is only illegal in India to have a sex determination test, sonography, for a child before they are born, whereas in the US and the UK they tell you beforehand that, oh, you're going to have a baby boy or a baby girl. This is the cultural implication. So how we can motivate people around them and go ahead with that perspective.
Right, right. Okay, now we're kind of like, inching towards our end time. So I'm going to quickly move to the next question, which is about how do you think can fertility complications and while undergoing infertility treatment, how can they impact women with the existing psychiatric conditions?
Okay, this is a very strong combination. When we talk about a female who is already under psychiatric treatment, psychiatric treatment, and when I say psychiatric treatment, they are under drugs. There are basically two kinds of treatment, either psychiatric or psychological. So when they are under psychiatric treatment, they're already under drugs, and that drugs are playing their vital role in the body for changing their hormonals and everything. And if the women is already under some psychological help in counseling or therapy, they both also have an impact on childbearing and infertility. When we say childbearing or infertility, it is something, maybe the female is in a severe depressive episode or a severe anxiety episode, or into a crux where she has a negative self image, and this can also lead her in not being able to bear a child, because childbearing is a biological process correlated with your happy mind to have a child. Oops baby happens with some people, but then it's something which we'll not talk about. Here we are talking about legally those who want to go for a childbearing process, and they are into that criteria where they want child. So in that, if the female doesn't have a healthy mental setup, so here the course of action can be that the female can initially, given that mental health support which is required according to her mental health condition, once she reaches a fine, stable stage, then the concept of childbearing should be added on. If two of them, so it will be like two problems being dealt together, will give results in none of them. Either her mental health condition will also, mental health conditions will not improve, nor will she be able to have a childbearing condition. So here, when we talk about that, it will be a combination of both, at when one reaches one level and then starting up to give a concept related to the first criteria. So if she is going through psychiatric medications, to see the dosage, how the combination of dosages are given, so that the childbearing process is not infected or is not slowed down. And if she's going through therapy, till the time she gets into a stable mental health criteria, not even think about childbearing as a process which can happen in that perspective.
Okay.
Yeah.
That's definitely an insightful information.
Thank you.
Moving on, I do have, my before I move on to my last question, I have, one from one of the participants, which is about second. Yeah, which is about how the urge, or how families pushing how when families push couples to produce children, especially you'd mentioned the aspect about vanshage badhao wala, right? How can women deal with that stress?
Okay. So when we are talking about this stress particularly starts as soon as you're getting married. There is no say, and in certain families I have seen, before even the marriage happens, चलो जल्दी शादी कर लो ताकि हम हमारे पोता पोती को खिला के फिर जाएंगे, even before the wedding has happened. So the concept of getting married is not about two individuals getting along with each other and leading a happy life. The concept of marriage in this situation is about people to bear children. That's it. So basically making them machines. Sorry, it was a bit firm, but yes, this is what they look forward for. So in that situation, women has again coming back to an individual who has to be strong from within, and not only from within in a way where she is able to take care of herself, but to bring that awareness that okay, हाँ मैं मना नहीं कर रही हूँ, I'm okay, I'm not saying that I'll not go for the childbearing process, but give me some time for myself, let me have some time for my relationship. And here she needs to be vocal and express her ideas rather than keeping stuff to themselves. And this situation has changed. Initially, women were not even given a say in this. शादी हो गई, एक साल में बच्चा होना ही चाहिए, and that was something which was required irrespective of whatever. एक साल में बच्चा होना ही चाहिए, नहीं हुआ तो then oh my god, you are in a big crime, you are committing a sin, बच्चा नहीं हो रहा है. And imagine if the family comes that you have used some contraceptive, then the disaster starts. But still in this situation, when the woman is doing this process or going through this situation, she has to be strong by herself, and her support system And when I say support system, here the family is not the support system. It can be friends, it can be correlated with the kind of job profile she is in. If she is a housewife, how she wants to take care of herself, get and again, this is something which we don't do, but it will be quite advisable if we can follow that protocol, that couples those who are getting married, if their biological equations are checked, it can be really effective as a process. We barely go for it. We always think of the problem when it has already started. But initially, if it is like, if either of the couple is thalassemia minor, either of it, then their process of childbearing might take a longer period as compared to a normal couple. Most of us are not even aware about this. So this is where, if we have these sessions in which we can go ahead of times, I'll not say ahead of times, but we just vigilant, it can help the women to suffice. And whenever we talk about childbearing process, it is always the stress of a woman and not of the men. This is the social system worldwide, irrespective whichever culture you come from. It is the social system worldwide, because she has been given the capacity to the womb and the capacity to bear the child. It is all her responsibility. So here, this as a young child, if you every mother starts inflicting that strength in her daughter, then I think most of the problems can get resolved pre the problem starts. That's okay, you want to bear a child, it's good, but then it is your decision, it is your time frame, it is your timeline when you want to decide and go ahead with it. This is
Definitely.
how we can work it out.
Definitely. I think you've highlighted a critical point here. Since we are also like running over time now, I'm just gonna quickly end with two sides of the problem that we're looking at. Right, we're gonna just understand from the spouse's perspective, and on a closing note, we're gonna look at it from motherhood angle. So the first bit is, how do you think anxiety and depression due to fertility complications or even miscarriage affects the spouse, and to what extent do relaxation techniques help when it comes to reducing anxiety, stress, anger issues, or even isolation?
Okay. Yes. So, very nicely said. I'll combine both of it, where we are talking about the spouse, his mental health condition. Because, see, when we are talking about motherhood, we are equally talking about fatherhood.
Right.
That the father, though he doesn't play an active role, but passively, he's investing a lot of emotional self into it. He's not involving a biological self, but a lot of emotional self is involved in that childbearing process along with the spouse. And if when we talk about a couple, they are emotionally already involved with each other and they are associated with each other with that bonding. And when we are talking about that bond, it is a strong bond which we are talking. And when we talk about a strong bond, it is a combination where a male and a female go through the same process throughout their lifetime. And it is not only the female's responsibility, it is also the male's responsibility. And now there are lots and lots of institutions which gives not only maternity leave but paternal leave as well.
Right.
So if there is a miscarriage, that paternal leave can be used not only by the female but by the male also, to have a bonding time with the partners. And this bonding time will help them to overcome their situation of either infertility, the process when they are going through that infertility way of getting the child, in case of miscarriage, going through that particular perspective and trying to get positive aspect. And see, it is said that child brings bonding and association within the family, and specifically the parents. Loss of child also adds on to that bonding if both are equally involved in that relationship. The clause is that the both should be equally involved in that relationship. It should not be only one person who is giving a lot of their time and energy and the other person just being a passive partner. So if both are active partners in a relationship, this relationship, and mental health criteria, usually why women have a lot of mental health issues, because of their hormonal imbalances due to the biological aspects of infertility which are happening in their body. Male are passively just observing it as an outsider. But if they start supporting it, it can be reduced and the combination can be like really given fruitful.
Right.
Thank you.
Definitely. I think that's a lovely way to put it. And I completely agree that definitely it is not one way, it's not an individual journey, I would say. It's definitely, both the partners are equally involved. As a closing note, when I mentioned about motherhood, I wanted to understand that how do you think a woman's mental health or a mother's mental health im- can it have any implications on the uh, fetus, essentially?
Yes, long. Because see, when we talk about mental health is not something which is outside our body. It is a combination of mind and body. So when we talk about mind and body, my mental health is of course giving a fruit to my body and it is giving me insight. By explaining it in a very simple manner, if you have a severe headache, will you be able to actively concentrate in today's session? No. And then this is your biological health impacting your mental health. In the same manner, if I'm upset about something since morning, will I still be able to be actively listening to the conversations happening in today's session? No. In the same manner, a female's mental health is equally responsible, because when we are mentally incapable, there are chemical secretions. We talked about oxytocin. There is dopamine. There are many other chemicals which are released in our mind when we are mentally unstable. And that can lead to your womb being either constrained or initially, if you remember, in our Indian system, when we come to know that the female is pregnant, an additional due care is given to that person. A lot of importance is given. Why? तुम्हें तो हमेशा खुश रहना चाहिए. You should listen to good things around you. But this happens only when you conceive. If this is started from the time when you're planning to have a child, it will be a very good perspective that there will be positive applause for you getting a conception very easily. So this way, mental health plays a very vital role in the formation of wombs. Uh, I'll just explain with an example, not only with motherhood, but with our regular menstrual cycles. When we are upset or in a stressful situation, our menstrual cycles breaks its journey and it comes early. The ovulation, like the egg breaking process, happens early because of the stress. Or if you are stressed, the menstrual cycle is a prolonged period. So imagine in such a simple thing, which is a routine monthly thing happening to every female, if that is affected by stress hormones, so having a womb which is ready to conceive is going to get affected by the stress hormone. So it is where therapies work really very well for women mental health who are leading into conception.
Definitely. Great. I think on that note, then we will wrap up today's session. It's been extremely, I think, eye-opening. We've, heard, Miss Ajab has really enlightened us in various aspects, and she's definitely broadened our awareness when it comes to understanding fertility complications, not just, looking at it from a biological perspective, but it is extremely critical, adding the social cultural values, the cognitive perspective as well, into taking all of these into considerations, along with the fact that any stress, any complication when it comes to fertility is not just the woman's responsibility. It is not a blame game. Motherhood as a journey is something which requires equal involvement by the father, by people around the mother. And I think if we, if we do acknowledge this as a society, if we take positive steps towards building a healthy atmosphere and, broadening our perspectives as well, I think we can definitely hope for some change. So thank you, Ms. Ajab, for sharing such interesting insights with us today. I
All
would
right.
I
Thank
would
you.
like to
Yes,
sorry.
sorry.
I would like to thank you for the great session from the entire team of Healthy Minds.
Thank you, Healthy Minds, and especially Paridhi and Khushbu for giving me this opportunity to work out and get whatever information I had to share it further with the group, because I believe knowledge shared is more useful than knowledge gained. So, with that perspective, thank you so much for giving me this opportunity. I hope it was a useful session for everyone. Thank
Definitely.
you.
Definitely. Thank you, ma'am. And for those of you who have queries that we've not been able to answer, or anything else that you would want us to, check with Ms. Ajab, then please do share them with us. We've shared our links in the chat section, and we will get back to you as soon as possible. We will, just to, also inform, we will be conducting our last session as part of our Women's Mental Health series next Sunday. And we hope to see you all on Sunday. And Miss Ajab, we really hope on connecting with you again on another interesting session.
Sure, I'm waiting for it positively too.
Perfect. Thank you so much. Thank
Thank
you.
you.
Bye.
Thank you. Bye. Thank you, everyone, for being such a lovely audience, because I'm seeing things in chat and I'm really happy. Thank you.
Thank you. Thank you, everyone. Have a nice day. Bye
Have a
bye.
nice Sunday. Bye, everyone.